Our research is trying to look into what is the vector of the tobacco pandemic, which is the tobacco industry. And we've looked at things like how the tobacco industry has influenced the science around smoking and health, how they've influenced scientists. We've done work on how the tobacco industry has been involved in smuggling its own products, which has health implications, and how many years ago the industry knew that smoking was deadly and kept this information quiet. You know, cigarettes remain the only product that, if used properly, will kill half of its consumers. The reality is, however, that in Australia, which has amongst the strongest tobacco control legislation in the world, 15,000 people still die every year of tobacco-related diseases. The cost to the state has been estimated at some $30 billion by health economists at Macquarie and the University of Queensland. What we're trying to do is provide more evidence for better tobacco control in low and middle income countries. And many of the countries we want to look at are in our neighborhood. In Malaysia, men still smoke at a rate of about 50%. In China, it's even higher. In Indonesia, it's anywhere from 65 to 70% of men smoke. What we hope to do is to provide evidence to the governments, to the health community, to the tobacco control community in those countries, but also at the international level, such as the World Health Organization, to give them more ammunition to find ways to combat the tobacco industry. If our findings can be used as evidence by international and domestic policymakers to try and save the lives of their populations, then we're doing our job.